Good morning, everybody. Thumbs up if you can hear me. Great. In the interest of time, I wanted to get started. Since we have a lot of things to get covered, and of course, everything is recorded, and so people can listen to this at a later time as well. Malia, how was your weekend?
My weekend was good. It was a lovely weather and nice to have some family time in town. Um, and I just, in preparation for today's reflection, I was just thinking a little bit about balance lately. Maybe because it's Libra season and wondering, how to hold everything that is coming our way, whether it be mourning losses of patients and family members, the people suffering from the damages and losses of Hurricane Helene, and of course the ongoing tragedy that we have of war in the Middle East and the Ukraine or in Ukraine. And then juxtaposed with lots of celebrations of life and expansion of our open door family. For those of you who don't know, Trisha Carter had her baby a week ago, and we've been celebrating all of that at Eureka and across the org. And my focus on sort of joy in practice and what an honor it is to care for people and to practice in this field. So I've just been sort of thinking about holding space for all of those things and wishing you all balance and acceptance of everything that may be coming your way or that you may be experiencing and holding in your lives now, and being okay with things being joyful and celebratory, as well as some of the sadness and things we mourn on a day-to-day basis. Back to you, Kelvin.
Thanks, Malia. Very appropriate as we welcome in the colder weather, but it's still great living on the coast here. I feel like as soon as October hits, the weather just drops very quickly. But then we've been very lucky with the nice weather in the afternoon, so it's a great weekend. So lots of things we are covering today. I just want to let folks know, no need to take any notes because after this, I'm going to send out a clinical update email to all staff, especially as we enter respiratory season. So no need to send anything out to your staff because I'll send it with all of the information today. So just sit back and enjoy the information. First, let's talk about respiratory season. And so I'm going to share screen now. Hopefully you all can see that. So once again, a reminder, when you go onto the hub, we actually eliminated, after last meeting, we eliminated the word COVID-19. And now if you click on it, it actually just says respiratory viruses. So this is encompassing on everything respiratory season, COVID, flu, RSV. And so I want to break this section into two different ones. The first one is diagnostic, treatment, and prevention. And then the second one is going to be vaccination. So if you click on respiratory virus here, diagnostic test, it will lead you to this page. And we actually eliminated a lot of the things now. So as you can see here, if you think and you are wanting to diagnose somebody for either COVID, flu, or RSV, these are your diagnostic options. Now, I want to remind folks that given that the treatment for flu, COVID-19, and RSV is usually supportive care, you should only consider testing if the results will change or affect clinical management. Meaning, is it going to change your treatment options depending on what of these things are? So just remember that. And if you decide you do want to diagnose with a specific diagnostic test, here are your three options. Both COVID-19 and flu are in-house. So those are 2 point of care that the back office can do. If you want to do RSV, it's a send out. It's a PCR send out, and you send it out to public health. And this is specifically in Humboldt County. So just keep that in mind. Only send out something or test for something if you think the treatment is going to be different from what you're planning to do. Because like I said before, most of the time, this is supportive care. The second thing is we have had a lot of changes to outpatient treatment options for COVID-19. So we just updated last night on this. So now this is the new algorithm for outpatient treatment options for COVID-19 for patients aged 12 and above. The bottom line is this: if someone tests positive for COVID-19, you just have to ask them, is it within 5 days of symptom onset. If it's not, then they can just self-monitor and symptom management. If it is, then you got to decide here if they qualify for Paxlovid, which in this case, are they older? Are they 65 and older? Are they 50 and older and not up to date on their vaccination, meaning never gotten a vaccine before? Or if they're immunocompromised with underlying medical conditions. So as you can see, Paxlovid is still a treatment option, but the criteria are more restrictive now, given the fact, and this is important right here, given the fact that the study data for Paxlovid was only done in unvaccinated people. We have no idea how it would do in vaccinated people, and so that's why the criteria are more strict now. So 65 and above, 50 and above who is not up to date with their vaccination, meaning have never gotten the vaccine, or they're immunocompromised. And of course, then you got to follow if they're able to swallow pills, their GFR is above 30 and their weight. And then you can do Paxlovid. But of course, make sure you check the drug interaction, and you have to decide whether or not what the benefits and risks are of taking Paxlovid versus holding the medications. And these are the treatment. This is the dose for Paxlovid, and of course you got to dose it if the GFR is between 30 and 60. Very different now. I've eliminated remdesivir and molnupiravir because the data, well, we don't have remdesivir here, it's at the hospital, and molnupiravir data is pretty slim now. And so just keep that in mind. Paxlovid is still a treatment option, but for most of our healthy patients, they might not even need to take it, because you got to deal with the side effects and have to deal with all of their drug-drug interaction as well. This is 2024, very different from 2022. And then the last thing is, if someone does have COVID-19, what do you do with it? And so the CDC gives you a very good preventive thing for respiratory viruses. You don't treat COVID any other different from flu and RSV. So the recommendation is pretty simple. You can return to normal activities when, for at least 1 day, both are true. Your symptoms are getting better and you're afebrile without using a fever-reducing medication. This guidance applies to flu, COVID, and other respiratory illnesses as well. So the days of quarantine, isolation, that's not very reasonable anymore. And so just keep this in mind. That applies to all of our respiratory viruses. Okay, so that was diagnostic, treatment, and prevention. The next one is, let's talk about vaccination. And so the CDPH published this very nice fall-winter immunization right there. And it breaks it down into influenza, COVID, and RSV. RSV is going to be a little bit complicated, so we're going to go through that. Bottom line is this. Flu, 6 months and above. And as you can see, we recommend it for everybody 6 months and above. COVID-19, 6 months and above. RSV, it breaks it down into 3 different sections. First one is in pregnant patients. So pregnant patient, the RSV vaccine is called Abrysvo. You don't have to worry about that. You just know it's a maternal SV vaccine, and it's available at all of our health centers. You want to give this between September and January. So just remember the date, September and January only is the months you want to do it. And it's given to pregnant patients between the 32 and 36 weeks EGA who did not, I repeat, who did not receive an RSV vaccine in their previous pregnancy. I was incorrect when I said that it's at every pregnancy at the last meeting. It is, you only need it once during the pregnancy. So if they happen to be one of the lucky ones who receive an RSV vaccine last pregnancy, they do not need to get it at this pregnancy. So it's only once between 32 and 36 weeks EGA in the months of September to January. Or, so if you are a pregnant patient, you receive this, and then you give birth to your child, and it's during respiratory season, your child does not need this next one, which is the RSV shot. And why I'm very careful to tell you it's called an RSV shot and not a RSV vaccine is because for infant, it is called Nirsevimab. Anything that ends in MAB, M-A-B, it's a monoclonal antibody. It's not a vaccine. However, in order for VFC to count it under their jurisdiction and paying for it, they put it on there, but the RSV shot for infant is actually not a vaccine, it's a monoclonal antibody. Doesn't really matter. But just so you know, in terms of an academic technicality, it's not a vaccine. It's a monoclonal antibody. It is available at all of our health centers, and you want to give this between the month of October through March, okay? And who qualifies for this? The people who qualify for this are 0 to 8 months infant who are born to mothers who did not get the maternal RSV vaccine during their pregnancy. So you don't want to need to do both, right? If your mom got vaccinated during pregnancy, you don't need it for the infant. If your mom didn't get it, then you qualify for it. So it's important when you see the 0 to 8 months patients, make sure you say, hey, did you get vaccinated for the RSV vaccine during your pregnancy? If not, then I would give them the RSV shot for the infant, the Nirsevimab. Or the second option is if you are born between 8 and 19 months with high risk of severe RSV disease. So that's the two indications for RSV shot during the season. And of course, it's between October and March. 0 to 8 months whose mother did not get the maternal RSV vaccine during pregnancy, or 8 to 19 months with high risk. Last one, the RSV for older adults. There are actually 3 brands. You won't need to know it because we don't carry them. It's only available at the local pharmacies, except our Open Door Rx does not carry vaccines, remember. So all the local pharmacies will carry the 3 types of vaccines for older adults. And it's basically the indication is 75 and older, or 60 to 74 with increased risk for severe RSV disease. So with that in mind, you can go to this. What happened to it? Oh, here we go. My PDF form here that Carolee kindly put together. It tells you all of the RSV, flu, and COVID vaccines that are available at all of our health centers. Bottom line, all of the vaccines are available. Fortuna was a little delayed getting it, but it should be coming this week. So maternal RSV vaccines available at NPS and RPS. RSV shots for infants available at all of our sites, and COVID vaccines available at all of our sites. So you can now begin administering these vaccines. Keep in mind, RSV at the 2 prenatal clinics, they've already started doing since September. Now it's October. You can start giving the RSV infant shots as well, since it's now available at all of our sites. Okay, so that's that. And then the next one is, I wanted just to let you all know, people have been asking about staff vaccination. What is the requirement for staff vaccination? And so I will send out the communication later on, so you don't have to do anything, but this is going to be our statement. As we enter the respiratory virus season, Open Door recommends that all staff keep their vaccination status up to date. We want to protect ourselves and our patients from preventable illnesses and maintain good health. All Open Door staff are required to get vaccinated against the flu by November 30th of 2024. So you have until November 30th of this year to get vaccinated against the flu. The COVID-19 vaccine is recommended, but not required. Those who decline getting the flu vaccine may do so in writing, like we did last year, and will be required to wear a mask through the end of the respiratory season. So I also updated the form that you can send to your supervisor. So if you're getting the flu shot, remember you have until November 30th. Get your flu shot, fill out this form, give it to your supervisor. They'll send it to clinical services to keep track. If you decline, press the word decline. I don't need to know why. And then just wear your mask until respiratory season is over. So we're trying to make this as easy and convenient for a supervisor. We do not have the mental load and the capacity to basically track this. This is an honor system, and this is basically what we used to do before COVID anyway. So everybody should be aware of that. So get your flu shot. If you want to get the COVID shot, it's recommended but not required. Fill out the form, give it to your supervisor, and then flu and COVID-19 vaccines are available for free to all of our staff at all of our health centers. Okay, so am I sharing screen? You guys can see the form, right? The PDF form, because suddenly right. Okay, next one, clinical update. So I want to let you all know, that as we have new people joining us, I'm gonna share this with all of our clinical staff as well, is our hub, the hub. If you click on clinical and operations, it leads you to our clinical updates. And I want to bring your attention to, there are a lot of good things on here. We have clinical updates that deal with 3 different things: preventive care. So as you can see about how to cervical cancer screening, appropriate order, colorectal cancer screening, lung cancer screening, a lot of good stuff on here. For chronic diseases, I want to bring your attention to, because everybody is, asking for Ozempic, Wegovy, things like that. So I want to bring your attention to diabetes and our obesity algorithm. Here's our diabetes algorithm first, that we worked on it and we just recently updated. It will tell you what medication is indicated depending on where they are with their diabetes diagnosis. It will actually also list indication when they have other comorbidities as well, when you use it, if they have heart problem versus heart failure versus diabetic kidney disease, and then how to actually start the medication and what is actually effective for weight loss, because oftentimes they go hand in hand. And here are the list of medications for diabetes. This is the moneymaker right here on slide 5. And with that in mind, we also created the obesity algorithm as well, because certain diagnoses will be covered by certain insurance, and we don't want to go this back and forth. So if your patients have diabetes versus obesity and they want Wegovy versus Ozempic, this is a great reference, because you don't want to delay it by then having to get a prior authorization and then getting denial for it. So this is our obesity algorithm based on popular demand. We actually created one, and it tells you about how to screen for it, what is the medication that is indicated, first line, second line, third line even. And here is your money chart as well on how to even start it. So this is anti-obesity pharmacotherapy table. It tells you that right here, for most insurance, if you're going to do semaglutide, which is a GLP-1, Wegovy is covered for weight. That's how I remember it. W and W. Wegovy, weight. And then Ozempic, diabetes. And if you can remember it, you can go and reference here on the hub for more information. If it doesn't get covered, then you can try tirzepatide and then liraglutide. Lots of options here. And then there's some second and third option as well if your insurance requires. For our partnership patients, I can tell you that Wegovy is covered for weight and Ozempic is covered for diabetes. And that's why we put this based on partnerships recommendation and their formulary. So that is how you can navigate our clinical resources here on the hub. You can also go to under miscellaneous. There's actually a lot of other good stuff on here. Like, for example, patients who are pregnant and want various options, you can have them down here for, it tells you pregnancy and option referrals, where to go to for that. We have 2 of our prenatal clinics, RPS and NPS, available. And then, of course, STI treatment. The other thing that is recently new that I updated, especially for people who have patients on controlled substances, right at the top, it says controlled substances urine drug monitoring. This is often required by insurance and also from the Department of Justice. That's why there's a cures there. If you click on it, it's called the controlled substances urine drug monitoring. So I broke it up into 3 different steps. Number 1, if you have low suspicions for aberrant drug. So if I have somebody who's on Norco, I see them out for a long time now, I'm not that worried about it. You don't actually have to do the point of care test. Instead, you can send it to ToxAssure, which is our LabCorp, and it will test you against 15 common things right there. And I put in the Epic order code for that. Now, for people who you are suspecting apparent drug-related behaviors, or if they're in your weekly MAT program, you do the point of care one. And if there's something suspicious, let's just say my Suboxone patients, I do it and they don't have Suboxone on the test. I don't assume it could be a false negative, right? Then I send it out for a confirmation. The reason why I'm telling you this is very important. Insurance companies will not cover for both. You can't just do a back office and then send it out again with the exact same code. They will only cover one or the other. That's why we work with LabCorp to say, if you do a back office one, and like I said before, my patient's supposed to be on Suboxone, there's no Suboxone noted. What I do then is I only order this code specifically to confirm for the presence of Suboxone. Then the insurance will cover both the in-house and the confirmation. So that's why it's important that you don't order both. Okay, it has to be, one is screening, the other one is diagnostic. And finally, for patients who you see for the first time who wants to enter our MAT program, we also, once again, do the ToxAssure 15 in order to screen for the 15 common things. Okay, so that was a lot of information right there. Let me pause to see if there's any questions. Is there a lag time between having COVID and getting a vaccine? So according to CDC, it's 2 months. But my thing is that this is a little bit of nuance. So the current COVID-19 vaccine was made to aim against the KP.2 viral strain, which was most prevalent in the spring. It was making, when I look back at CDC data, it made up of 90% of that. If you click at CDC right now, that strain, KP.2, it makes up in less than 10%. So I actually believe if you gotten COVID in the last, I don't know, 3 to 6 months from the spring until then, you're probably protected and you probably won't need this current COVID-19 vaccine. But like I said before, this is optional. It's up to you if you want to do it for extra protection. But I don't think you'll need it because you've already gotten it through natural immunity. Okay, next one is organization update. First things first, peer review. Peer review is happening, of course, once a quarter, and it's for our medical, dental, and BH providers. So the next round is happening next week, October 14th to October 25th. You'll get something from compliance next Monday to start doing it. So this applies to our medical, dental, and BH providers. It will not include our locums. It will not include our APC and FM residents. Medical providers, they can do it during their admin time, so no need to block their schedule. For dental and BH providers, the process will be the same as previous peer review. And of course, for our medical providers who also do OB, Emma will lead the group peer review meeting for NPS and RPS providers. Next one, a reminder again, annual performance that are being done on Workday. It ends on December 6th. So right now, all of you supervisors and managers should be scheduling your one-on-one with your providers to look at their self-evaluation. You do your thing. And once you submit it, they have to confirm it. And so just make sure you start. If you haven't done it, you have about 2 months left. So please schedule them and do them as soon as you can. Okay. 2 more things, and this is important. So I want to just take some time right now at the end of the meeting to address it. 2 important things that have to do with our community. First one is Mad River's closure of labor and delivery. I believe we discussed this with you all last month. And so Tori met with Doug, the CEO of Mad River, and also Michael, the CEO of Providence St. Joe's here locally. And basically, we had we discussed a transition plan. So starting November 1st, that's the Friday at the end of this month after Halloween, when everybody's all sugared up, starting at midnight, November 1st, Open Door will only do OB deliveries for our pregnant patients at Providence St. Joe's. We will stop doing OB deliveries at Mad River because they are closing down their labor and delivery unit. Both NPS and RPS health centers both of our clinics will continue to see our patients and offer all available services. So that doesn't change. Our outpatient clinical services do not change. The only change is going to be is we will do all of our deliveries now at Providence St. Joe's. So what that means is we're only going to have one call group. All of our OB providers at Mad River will now join all of our OB providers at St. Joe's, and we're going to have one call group to take care of it because the volume we'll assume is going to double. Right now, it's going to be at 1 hospital instead of at 2. So that's a big thing. But I want to make sure we reassure our staff the services, the excellent services of care that we provide do not change. NPS still open, RPS still open. We just do all of our OB deliveries out of Providence St. Joe's. That's the first thing. The second thing is, as you probably heard last Monday, a week ago, the California Attorney General brought a lawsuit against the local Providence St. Joe Hospital. What that means is the case centers around emergency abortion care access at Providence St. Joe's, and it has to do with its ethical and religious directives, known as ERDs, of the Catholic Church. Providence is a Catholic, it's run by a Catholic church, right? So it has to follow its ethical and religious directives. And so that's what the Attorney General is bringing suit against them involving emergency abortion care. This is between the Attorney General and Providence St. Joe's. Tori has been meeting with Providence St. Joe's CEO on the current situation. And so we are addressing that. I want you all to know, specifically from Open Door, we will continue to advocate for clear policies that allow patients to receive safe, evidence-based care during their pregnancies. So I repeat, Open Door, we will continue to advocate for clear policies that allow patients to receive safe, evidence-based care during their pregnancies. We want our community to feel confident in the services and the care that we provide. So those are the two things I wanted to address to let you all know about. Okay, with that in mind, let's recap. And of course, no need to do anything in terms of taking notes. I'm going to send out an extensive email to all staff with all of these updates after this meeting. Whew, man, I'm tired. Number one, respiratory season. Look at the hub, diagnostic, treatment, prevention, vaccine, staff vaccination, get your flu shot by November 30th. Sign the consent or the declination form and give it to your supervisor. Clinical update, lots of good information on there, especially with our obesity and diabetes algorithms. Please look at them so we don't delay prior authorization. Don't send the wrong one, semaglutide version for a different indication. Your insurance is going to kick it back and your patient's going to get pissed, and then it's a delay in care. Organization update, peer review next week. Make sure you remind your medical providers to do them in the admin time. BH and dental, they know what they need to do. Annual performance, please schedule and do them. Starting November 1st, we'll do all of our deliveries at Providence St. Joe's. And we will continue to provide excellent, safe, evidence-based care to our patients, regardless of what's happening right now with the Attorney General's lawsuit against Providence St. Joe. That is against them. We are a different entity. And then next meeting is going to be on November 4th. Okay. Have a good October, everybody.